Beginning with equipment, when addressing problem behaviors in regards to sensory modulation, it's going to be very important to modify the sensory environment whenever possible. When we're not able to change the actual environment, a sensory diet may be useful to implement in these children's lives. A sensory diet is just a list of activities chosen based off the child's sensory needs that can be specifically scheduled into a child's day to help with arousal level and adaptive responses. For technology, children with autism spectrum disorder benefit from and react well when there is structure in their lives. Implementing technology and use of scheduling apps may help the individual adapt to changes and transition throughout their day. It also might help reduce inappropriate behaviors and help the individual develop independence. Some assistive technology that can be integrated into the child's life are apps on the phone, including the calendar app or alarms, visual schedules. These can use anything from tangible objects representing activities to pictures with Velcro or even words and check marks for the higher functioning children. These are great because they're adaptable to different children and they can be used in a variety of settings. Using visual schedules can increase independence and help individuals learn to move from one activity to another using the schedule rather than relying on someone else to lead them, in addition to increasing flexibility and ability to cope with these transitions. Studies have shown that video modeling has positive outcomes in skill development for becoming more independent with ADLs. In relation to an individual's morning routine, video modeling can show the sequence of a morning routine, including hygiene, dressing appropriately, and feeding. In regards to caregiver instructions, education is a very important component of therapy with children with autism spectrum disorder. Family education on diagnosis, how the diagnosis is specifically affecting the child, and any modifications needed to promote functioning. It's also important to carry over things learned in therapy to the home. Parents should be continuing to promote functioning through the use of techniques and materials provided in their therapy sessions, such as social stories, sensory adaptations, interactive play, and social interaction opportunities. Moving on to responsiveness and sensitivity of the parent. Adult imitation is when a parent imitates the child. It was found that this method promotes eye gaze and results in positive affect in attending, due to positive responsiveness and application of prompting and cueing. This method provides opportunity for and a supportive environment for social interaction. Research has identified adult imitation of the child's actions to have positive effects on social engagement in children with ASD and promoting the child's participation in interactive play. It's also important for the parent to be sensitive to the child's needs, for example, arranging the environment to increase the child's interest in activities as well as in regards to the sensory preferences. It was also found that arranging the environment to present challenges to the child, such as placing their toy on a high shelf, increased communication attempts. As for follow-up, it's recommended for children with ASD to follow up with a behavioral therapist for early intensive behavioral interventions. It's also recommended for these children to continue seeing speech-language pathologists and a physical therapist to address and manage hypotonia.